All right. Well, we're back, and apparently, since our last Facebook Live, Facebook decided to change their interface and all of their options, so that's fun. Um, we'll just have to,
On our toes.
yeah, just keep rolling with the punches. So, hey to everybody who's here with us.
Morning.
Jump in, say hi, say good morning. Thanks for being here. We're going to do a little adventure this morning. Read a little bit of a mindfulness exercise just to kind of get everybody plugged in and tuned in. And then I'm going to ask my beautiful bride here some questions about what she does as far as hospice massage from people that I've talked to, as I travel the country and try and share the awesome bright light that this woman over here is. So we're going to shake down some information on that as well. And then some of you may or may not know that today is PTSD Awareness Day. So I'm going to say a little bit on that. And then, hey, Dana. And then we're going to finish, as we do, with a little bit of self-care, just to kind of give you the chance to plug in with minimal effort, because it's Saturday, and some things need to be effortless, given the amount of effort we have to put into waking up every day and doing all the things that we do in adulting land.
Mm-hmm.
Yay. So, like I said, we'll start with a little bit of mindfulness. So what I want you to do is just kind of in your mind space, imagine a camera lens, right? That as you zoom in, you're able to look far off in the distance and bring it close to you with clarity. Okay, that's what I want you to put in your awareness as we walk you through this. And the tool that we're going to use to be our camera lens is going to be our breathing. So we'll just all take a nice deep breath in and just hold it. And then we're going to let it go. Okay, so let's do a couple of those. And then our focus today is going to be, as we breathe in, we take a hold of the camera lens, and as we exhale, we want to focus. And what I want to focus on is our heart space. So in your mind, you can find the actual anatomy of the heart being a little bit bigger over here on the left-hand side. Perhaps you're drawn into the metaphorical heart, the cartoon heart, the love space. So with each inhale, just get a little bit clearer on whatever comes to your mind. And on the exhale, just let it come in detail. And feel whatever you feel. Feel all that you feel. Even if what you feel is nothing. Just be aware of that. One big breath in. few-minute exercise of mindfulness and awareness gives us the ability to plug in and come back to present. It's a judgment-free zone from this side, but also for you. Okay, there's a restaurant bar that I used to go to in Costa Rica called Lo Que Hay. The rough translation is it is what it is. So when you find yourself in those spaces, it is what it is. Okay. So thank you for taking that walk. So this morning we have the pleasure of coming to you live from my massage office located in Winter Park, Florida, that is now open. Appointments are available, book online. And we'll have our fun little COVID conversation before you come in to see us to make sure that I'm safe, that you're safe, and that we're safe. So, but this morning it's a special privilege to be able to do this and open up the door to a conversation that I've had as I've traveled over the last few years. What, 5 years you've been working with?
6.
Okay, 6 years. So over my last 6 years, traveling and teaching and sharing and learning, watching this beautiful creature next to me just bloom into this amazing professional that walks a really tough road, right? Doing things I couldn't do. No way. But she does it with grace and style. So we're going to have a conversation about what that's like for non-normal human beings like this one. So let's start with one of the most popular questions that I get when I'm on the road is, are you a volunteer or is this a paid position?
I am a full-time employee for the company that I'm at, which is amazing because it's like a real job for a massage therapist. So I'm a Monday to Friday, kind of 9 to 5-er, weekends off, PTO and benefits and the whole 9 yards. Volunteerism is still a big thing in hospice massage, and around the country you can find volunteer positions, which I think it's a great way to kind of get your foot in the door of a company. My concern with it, though, is it limits how much massage those patients can have access to. We only have so many hours we can give out for free. We have bills to pay. And as professionals that have trained passionately to do the work that we want to do, we should be rewarded financially for that. So on both the therapist end, as far as like getting paid for what you do, and then on a patient end of just having access. So if I have time to go visit a patient every week and they're seeing the benefit of that, I can do that. I'm getting paid either way. So, that's the nice, that's the nice thing. The other thing is, I'm getting paid whether I'm writing my paperwork or I'm driving to the next home or nursing home.
So you're not locked into a single facility?
No, although some around the country, some hospices are just like a single location. Okay. It's a building, an actual, but a lot of them are moving to a more mobile situation because people don't want to die in a hospital. They don't want, if they have the choice, they'd rather be at home. Some wouldn't. Some would rather not be home.
Right.
And so it kind of gives people the option of, what do they want their last days to look like, and we can kind of cater to that. So it's really nice.
So assisted living facilities, people's homes,
nursing
homes, hospitals, because you specialize in pediatric care as well. So
yeah,
in general, you might be going to the
yeah,
children's hospitals and things like that.
Yeah, those kids can have concurrent care, so they go back and forth from the hospital a lot because, of course, the parent's not going to say, "Let's just give up and let my kid die."
Right.
No parent's going to say that. So yeah, I do end up at the hospital at times.
Okay.
Working on kids.
One of the things that is challenging for a lot of people, myself included, when we talk about this is, as massage therapists and healthcare providers, we have this mindset of we're trying to help them get better, right? So in hospice care, like, you don't end up in hospice because everything's going really good for you. So what's the shift in your mindset as far as wanting to help, but also realize the potential for getting better is significantly capped?
Yeah.
Like, how do you?
I focus on comfort. I think being very upfront, setting goals with people it's so important, because you can walk into a house and there'll be, the daughter will say, "Oh, I'm so glad you're here. We're going to start massage. I really want my mom to walk again."
Right.
And you have to have that really real conversation of, like, maybe she will. I'm not going to take that away from somebody.
Right.
Maybe she will. But that's not going to be my goal for care. My goal is going to be, where are you uncomfortable today? And can we soften that?
Mm-hmm.
Can we make you more comfortable? A lot of times the discomfort is this.
Sure.
So it's gentle massage and a nice visit,
and
they feel much better, but it's comfort based. Now, that's not to say, like, a patient can't, a lot of times we'll see this, like, where a patient, they're getting less steady on their feet and they have an almost fall, and they catch themselves and they'll tweak their shoulder a little bit.
Okay.
Now we can have some success with that over the course of some weeks, working on that soreness and getting that to resolve, Are we going to fix a torn ligament or a frozen shoulder or a 60-year-old neck injury? No, but we can soften the edges.
Right, because
that's what we're trying to do.
Their bounce back is not, it's just not.
That's another big thing. Like, yeah, their cells are not repairing at the same rate as a healthy person.
Right.
So you're working with that as well.
Yeah, it's pretty powerful stuff when you look at pain, right?
Mm-hmm.
A lot of the conversation we have, and a lot of the conversations that I have with people, is the conversation about pain. Like, oh, that hurts. Well, does that hurt, or is that sensationful? Right? Because your nervous system has a different response to this pre-conceptualized idea of pain than just being very sensationful. And one of the things that I'm trying to study, and we have conversations about this, is understanding the pain science and the biopsychosocial model of pain, and that pain isn't always physical. Sometimes pain is mental. Sometimes pain is social. It's one of the things that we're seeing now in this COVID era that we're in, is the amount of social pain that people have, and social discomfort, as we ask the questions like, are we cool to hang out? Like, is it, what do we do? So that it's that disconnect. But I like how you focus on providing comfort.
Yeah.
Right? Because if we can help land the plane more gently and make that transition as easy as possible, that's got to be one of the greatest gifts that we can share with another human being. So, yeah.
And if people can take less pain medications, most of them would prefer that. They don't want to be groggy and out of it and constipated,
right.
And, all the side effects from pain medication. So it's such a good value,
Mm-hmm.
to bring that hands-on work and not just have a pill for everything. So it's hospice companies more and more are seeing the value in that non-pharmacological approach.
Mm.
You know?
So what you're saying is touch is important.
Absolutely.
So in a day,
touch and connection. Yeah.
In a day, how much hands-on, like, manual tissue manipulation are you doing? Because obviously you're not doing like forearms and elbows and deep tissue.
Yeah, no. Depends on the day.
Okay.
I travel probably more than most massage therapists because I do the pediatric team. So I have my little adult teams that are, on my side of town.
Mm-hmm.
But then I'll take pediatric patients that are in other cities and even other counties
mm-hmm.
at times, depending on the need, so there's drive time to consider. Like if I have 5 patients in a nursing home altogether, I can knock them out and still probably go see 3 home patients.
Knock them out.
Yeah, and probably still go see 3 home patients if they're
Okay.
all like close together.
Okay.
It just depends. It depends on the day. I would say an average of 5 in an 8-hour day. 8
Okay.
hour. Yeah.
Okay. Are there any, because we've had this conversation about, and I hear it about on the road a lot too, of, what type of massage? So like, is the general public, for those of you that are the general public and you're not in the profession, I'm going to drop a little bit of education on you. It's not about branding a massage, deep tissue, Swedish, trigger point, myofascial release. Those are all just names, right? What you need is somebody who has a qualified, skilled, passionate, professional touch, right? Which is why I named the company Touch Education years ago, is because touch is what matters. Mm-hmm. So when we look at what kind of approach you have to treating, is there anything in this time of stress that we're all living with? Is there something you can pull out of your experience as a massage therapist in the hospice world of how to approach somebody who's distressed? And like the word that pops into my mind is like a de-escalation, mm-hmm. considering the world we're in, and everybody wants to outrage and fluff up the bullshit. Like, do you have a way to just kind of walk into a room and you have something you want to share with the squad of?
Yeah, I love that question.
Yeah.
In the world of hospice, there's so many different scenarios, and of course, when you're dealing with people, there's going to be different situations. So mm-hmm. I can think of one situation that I walked in and the patient was calm, but the caregiver was at like an 11. Mm. Just so,
Oof.
Just wanting to do everything and wanting to fix everything. And he was like, mm. Okay. And then I can think of another situation where I walked in and a patient was actively dying. Mm. It was a brand new patient I hadn't seen before. And the nurses are just sitting around in this room chatting about life and their daughters and what they were going to eat for dinner. And this woman was taking her last breath. I can think of another situation where one of my patients with COPD was having like severe shortness of breath as I entered the room. Mm-hmm. So there's all different reasons why you're gonna, or maybe like maybe an Alzheimer's or dementia patient that's very, very agitated mm-hmm. when you walk in the room. So it's OODA, right? Mm-hmm. Like mm-hmm. you walk into the room. And
what's OODA?
You want to explain it?
No, you explain it.
So OODA, when you walk into the room, you're observing what is going on in this space. You orient. Where am I? What's my piece mm-hmm. in this space? decide what can I do to make this situation better, and act. Right? That's OODA. That's a military term, I believe.
Yeah, OODA, OODA, observe, orient, decide, and act. It's basically a classroom setting to teach situational awareness, which is something that we can all benefit from. So in Nicole's example, like she said, the observe, orient, decide, and act, when you walk into a space, pay attention to what's going on. You know, in terms of masks, right? If you walk into a place and there's a bunch of people not wearing masks and you feel that response, go somewhere else. You know, vote with your money. If the stores aren't going to enforce a policy, go to a different store. You know, observe and then go, okay, I don't want to come in here. I'm going to make the decision and I'm going to act. So when you're going in and you see let's use the example of the bumblebee, right? Caregiver around the patient.
Yeah.
So what could you share is like one thing when you walked into that room, how did you bring that back into balance?
So I became the anchor.
Okay.
And I sat with him and gave him some education, you know, about when you are up here, you're going to cause your wife to have anxiety, you know, and it's like this feedback loop. So, you know, I taught him just about taking a breath. Leave the room for a minute and take a breath if you need to. If you're just getting too wound up, put on some calming music. Like just, you know, different techniques to help bring down the vibration of the room. You know, and then this lady that was actively dying, I'm not going to give her a massage. Right? Every system is shutting down and she is literally taking her last breaths. But I put on some gentle music and I held her hand. Because no one should die alone. You know, not if we can have anything to say about it. And she was basically alone. You know, those ladies, I'm not demonizing them in any way. They see that stuff every single day. I don't. That's a rarity for me, you know, but this is kind of like a normal thing for them. And you can get very desensitized.
Well, you can be alone in a crowded room too.
Yeah.
So, absolutely. You know, loneliness, it's not correlated with the amount of people around you. You know, it's, yeah.
So you got to take that OODA to the person too, like observing where they're at, what they need when you're the therapist.
Yeah.
You know, the gentleman that had the shortness of breath, I had to go into action. He was in a nursing home. I called his nurse into the room. I alerted my company to let them know so that the whole team was aware, and they got him, you know, medicated and comfortable. And then I came in and gave him a nice relaxing massage. By the time I left, he had a big smile on his face and he was laying, you know, nice and calmly in his bed.
So that brings up a really good thought is you spend a lot of time representing the profession to these other healthcare providers, right? So you're having to, whether you're conscious of it or not, you know, and your coworkers too, having the conversations with the doctors, helping them understand what massage can be to a particular patient. So maybe that's, you probably thrive in that meeting setting, listening to maybe the nurses and the doctors talking about the different patients and being able to kindly interject and go, you know, I think this is where massage might be really valuable for this particular patient. So kind of sharing the change of what can be with those other allied.
Yeah, that's one of the coolest parts is working with that interdisciplinary group.
Sure.
You know, and getting to really understand the progress of the disease. These nurses, they see these things all the time. They know pretty much what's going to happen next.
Right.
And so I've learned a ton, but I've also had the opportunity to educate nurses and doctors about what it is that we're doing, even social workers, although, you know, like those kind of fields, I feel like for the most part already get it.
Yeah. Yeah, we've had a lot of conversations about the social workers, the music therapists being sort of like your two main intercompany allies, as far as you have some of the same common threads.
Yeah.
What
chaplains too.
Chaplains. So, as a person who is big into music and the role that music plays in our lives, and you know the concept of harmonic convergence and these different things that I'm working on, I wonder what is it like to provide therapy while live music is going on?
It's amazing.
Yeah,
it's kind of, you have to like align the stars, because we're all, you know, we all
particles
have our
bouncing
own,
around.
We're all driving in different directions, but when it works out that we can meet at a patient and give a dual therapy, it's so beautiful. Because those girls are, they're not just girls, there's guys that do it too, but we only have girls where I work. They're so good at what they do. It's a science. They don't just come in and play, you know,
Freebird,
kumbaya for everybody.
Right.
You know, it's a science. They're looking at the breathing rhythm. They're watching the pulse. They're interacting. They're asking questions.
Sounds like another future Saturday conversation.
Yeah, it's
we need to get some of your music people in here and explore that.
During this COVID thing, when I was working at the office, one of the music therapists was working there too, and they let us do some self-care stuff. So I was able to like teach some yoga and mindfulness, and they would come in and play live music. So cool.
So any of you out there that are watching this, whether it's live or later on when we post it and you're watching on a replay, if you have the ability to have live music, it might be worth exploring and looking at it and going, can I bring in my friend who plays the guitar and maybe pick one of your favorite clients and invite them in to be part of a practice session? I don't know. If you are a musician and that's something you'd like to do, hit me up. Because if you live in Orlando, especially, because that's kind of where we're at right now. So would love to entertain that as an option. What do you feel, in a two-part question, what do you feel your work, where's the value in what you do, like the biggest value that you feel you're able to provide? And then what's the biggest value for you that you're able to take away?
So the providing one is pretty easy. Like when you're in this medical model, you get touched, but it's like,
poked and prodded.
Here's your bath.
Yeah.
Here's your medicine. Let's wipe your butt. Change your diaper. You know, like you get touched, but it's not quality touch. And there's a lot to do to take care of a person's every single need. So I get it. Like, it's a lot on a caregiver. It's a lot on the CNAs. You know, they give those girls, 10 hours of work to do in an 8-hour day. You know, so they're scrambling.
Yeah.
And so many of them are amazing at what they do. So I'm not.
Hugely valuable role. I mean, it can't happen without that.
Right. But I have the time to go in there and gain rapport, look someone in the eye, get on their level, see how the initiation of touch affects them, give them some gentle massage, listen to their needs, communicate. Because a lot of times people, they'll tell their nurse, no, I don't have any pain. Because they know if they say they have pain, they're going to get a pill.
Right.
They're going to get some kind of intervention that they're not interested in. So a lot of times when I'm communicating with the team that, this person's having a lot of leg pain. They say it's, seems to get worse when there's like rainy weather or stormy weather. And, they kind of tweaked it going into the bathroom the other day. And the nurse will be like, they never complained about pain to me. They just, it gives them, and also because you're in this space, kind of giving them that awareness. Like, let's be in your body now and be present and be here. It also, they remember, oh yeah, my shoulder has been bothering me. Whereas,
the faster blip in, blip out just doesn't.
Exactly.
So what's the piece for you?
I mean, there's just so much. It's hard to nail it to one thing.
What about a single word? Is there a word that resonates with you?
The first one that comes to mind is perspective. It's hard to go out and visit all these people and then come home and not appreciate our health, our family.
Right.
So it gives a great perspective. Like, you really got to appreciate, none of us are guaranteed tomorrow.
Right.
And
you ever find your give a shits list?
Yeah, exactly. Yeah. And it changes your perspective on death too, because it's unavoidable. It's coming. It's going to happen.
Right.
And
none of us get out of this alive.
Yeah.
Sorry.
But it also can be beautiful.
Yeah.
It doesn't have to be scary and terrible. There's beauty in it. It's a part of life.
Sure.
So every book has a final page.
Right.
And it's not even about how thick the book is. It's about how good the book is.
Sure. That's a great example. Yeah. Yeah. Let me see here. Working alongside the music. Yeah. Yeah. When you think about, because we're working on bringing a hospice massage class to life through touch education, in the midst of everything that's going on, so the modification of what education looks like is going to be significant. But what would massage therapists have to look forward to? Just like one thing, like, because I remember I went through your PowerPoint and was just blown away. So maybe I'll share the piece that I'm excited about you sharing.
Okay.
Is the piece of, like, right out of the box, talking about the things that matter, right? Last will and testament. What are the wishes of the patient? And as a massage therapist, how do you enter that space to honor them? Right? Because you might have somebody come in who's atheist, and you're walking into a very spiritual household, very religious household. You have to take all of your stuff and just zip it up and leave it in your car, go in, do the thing. Right.
Not even a little bit.
I think that's good for our profession. I think it's good for people in general to look at this and go, okay, this is really about being a human with a skill set for another human. And I think that kind of needs to be the focus for all of us, is how do we maintain our humanness with another human And let's stay in that space and have conversation as opposed to trying to say who's right, who's wrong. And yeah, I'm kind of going a little bit into the politics of what's going on in life today. But even in the hospice setting, you can't bring your bullshit into the treatment room.
You gotta leave your ego out of it.
Gotta go.
You could have had a wonderful session with this dementia patient last week and felt a huge connection and done a lot of good work.
Mm-hmm.
And then when you show up the following week, they're like, I don't feel like massage. No, thank you. Or they're like, get the hell out of my room. Or, and it's not about you. If that's what they want, I'm going to give that to them.
Right.
I'm not going to force myself onto someone because it's good for them.
Right.
Because if they don't want it, I'm not giving them a blood pressure pill. It's massage. You have to want it.
Right. Right.
So it's not about me. It's not about, it shouldn't ever be about any of us.
Yeah, because at that point it's unwelcome touch.
Yeah. And I think that's good advice for massage in general too. You can't force anything.
Mm-mm.
Don't force it.
Yeah, we can't.
It's not about you.
We can't fix people. So, and we're also, we're not healers.
Right. Get a job in hospice and call yourself a healer.
Right. We are facilitators of change. We, as professionals, we bring a skill set that helps to unlock the healing potential of your body. And then you may have greater range of motion and you may have more flexibility and you may feel the change as you leave the session. But once you walk out our doors, it's your body's immune system and your neuroendocrine system that have to recognize and regulate and go, oh, I can be like this now, and this is how I can be. We're not laying hands down on you and yama, 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 healing. That's not how this works. And that's, since she got this job working in hospice, it's one of the things that I take to all of my classes. Because inevitably in our profession, we're going to have people say, I'm a healer. And yes, you are of you, but if you're going to be a professional, you need to check that ego back down. Because if you are that divine of a healer, then there's a pediatric hospital anywhere in your town that could use your help. And those parents would be happy to have you. Otherwise, let's just dial it back a little bit and recognize our role as facilitators. Like, we're here to help people, whether it's hospice or it's, a friend of mine right around the corner here in my office. He does amazing assessment in medical grade body work to really help people with really significant issues. But it's when they leave, are they doing their corrective exercises? Are they doing the things that he's asking them to do? If they don't, they're not going to get the results that they're looking for. You don't get to complain about the results you're not getting from the work you're not doing. Sorry. And even if it's me working with a PTSD clientele, I can only do so much, which can be a lot for a lot of people. But if I come into the room saying I'm going to rid you of PTSD, then, I need to just go home and punch myself in the face. That's really the better option, because you're putting the ego in the situation. There's just no space for that. It was something that I've tried to actively just separate myself from a long time ago. It just doesn't do any good. It creates room for errors in the States. And that's just not, especially in the hospice population, you don't want to be that reason. You don't want to be that person. Right. That makes a critical error.
No. But that brings us back around to PTSD. And it's PTSD Awareness Day. So let's talk about that for a minute.
Because it's lighthearted.
In 2020.
Yeah.
Not just COVID. So many news events, so many things happening around the world in our own lives. Remember I made that list of just,
punches.
Wow,
body
everything
blows.
we've been through in the past like 6 to 8 months.
Yeah.
It's crazy.
Yeah.
Are we all walking around with PTSD?
We're walking around bruised. We're walking around broken. On some level, we're also walking around functioning.
Mm-hmm.
On some level, we're all walking around thriving.
Mm-hmm.
The concept of, does everybody have PTSD? Not yet. We can't really get post-traumatic stress disorder until we're post. And last time I checked, we're not post. It would be great to be able to look back when we can and go post.
Mm-hmm.
But the truth is we can't. And this is about endurance.
Yeah.
This is about resiliency.
Mm-hmm.
This is about feeling the burn and putting the work in, right? Whether it's COVID or all of the politics and the polarization, all we can do is work to be better humans. So when we look at, do we have post-traumatic stress disorder? No. I'm not a mental health counselor. I don't play one on TV. I didn't stay at a Holiday Inn Express last night.
Mm-hmm.
So my scope of practice does not allow me, nor do I try, to diagnose people. But if you look at the criteria, you have to be 30 days clear. So that would be technically acute traumatic stress disorder. Or I'm sure that there's other clinicians that would use different terms that way. But what I'm looking at in my practice as I slowly open up a brand new practice, first time in over a decade, to have my own space and begin treating my own clients and patients. Super excited about that. Like it kind of gives me goosebumps because it's the first time in a long time, to be in that space. To walk the conversation forward of meeting people where they're at, like you do,
mm-hmm.
and have conversations about what is anxiety, what is fear, what is grief. I don't have all the answers, but I'm really good at finding better questions. Mm-hmm. And it's not about leading the client to an answer or a resolution. It's about taking a human being into the feeling of their body to try and understand, is that something that's being fed, or is that something that's necrotic?
Mm-hmm.
Is that an old injury that is, it's just like an old piece of scar tissue, whether it's from a fall, when you were a kid, or it's a broken heart, or loss. Mm-hmm. That's one of the things, loss and grief is one of those conversations that we don't really bring out and have conversations about in open spaces. Mm-hmm. Because it's scary. It's people might cry.
There's a vulnerability there.
Yeah, let's be vulnerable. Admit humanness, so that when we have these conversations about trauma, trauma is not always a bad thing.
That's a great point.
Sometimes trauma is phenomenal. It may not feel like it in the moment. Mm-hmm. Like losing my dad, not one of my favorite things. Mm-hmm. Breaking my forearms in a car accident, right. Definitely not one of my favorite things.
Right.
Dropping the F-bomb in front of my mom because I'm sitting on the ground with 2 broken forearms, not my finest day. Mm-hmm. Right? But it was a day of turn, right? Which led me here. So we can take these traumas, and if we can change our perspective, like the mindfulness activity we did at the beginning with the camera lens, right? If you live your life as a hammer, all you're ever going to see is nails. So the idea of, are we all living in a time of PTSD? No. But we're living in a time of trauma, which means we're also living in a time of change, which means we're going to live in a time of discomfort. But on the other side of that is growth, is evolution, is beauty. You know, I'm looking forward to the music that comes out of this time. You know, you look back at the tumultuous times of the 60s, the music that came out of that time. Like the expression of arts and seeing art and creating art, like that's what I'm looking forward to.
Yeah.
You know, and recognize that if you find yourself caught up in the storm and you're consuming media, you're consuming, and as you consume, you get more fired up. It's a self-inflicted gunshot wound. Okay? You can't consume a McDonald's lifestyle and expect a healthy body. You can't consume mental junk food, toxic consumption, and expect a different outcome other than your nervous system going, everything's a threat.
There's a turn from thinking about your mental health to changing your perspective to how can I feed my mental wellness?
Mm-hmm.
You know, that comes down to self-care.
Yeah, put deposits in that bank account.
You know, at night, I know that I don't want to watch a violent movie with things blowing up or people being kidnapped or having a lot of stress. I want to watch slow TV. I want to watch something that
Julia Child's Cook
lands the plane. Yeah, that's a gem.
Right, Bob Ross painting.
For me, you know, that might not be for everybody, but I know through just paying attention what helps calm my nervous system down. You know, doing yoga, meditating, praying, writing in a journal. You know,
being married to this guy.
That's a huge piece, but no one else can do that.
It's true. It's true. There's only one.
Yeah.
Okay. So as we, kind of close out here, I want to leave you guys, girls, with a non-binaries, everybody, all the people, all the humans.
What if there's puppy dogs watching?
Puppy dogs too. All the creatures. Kitty cats. I don't know about snakes and birds because I'm not a snake or bird person, but whatever. The alligator in my backyard, not sure, but
he's cool.
It's fine.
He's swamp cute.
Yeah. So what I want to share in terms of self-care is this. So in your body, you've got your sympathetic nervous system, which is designed to keep us safe, threat analysis, respond to danger, right? And we'll get more into that. And those of you that are students, alumni, friends, or if you even just sat next to me with enough, whiskey in a glass, you've heard this conversation at least once. But what I want to do is I want to stay in this pocket of perspective like we've been talking about. It wasn't planned, it just happened. But since we're there, we're just going to stay in that pocket of where Nicole was talking about. She's done the self-awareness of recognizing that she doesn't want to watch these TV shows or be exposed to that because she understands how her nervous system works, right? That's a perspective on one Trivial Pursuit pie piece. What I want to offer all of you is this. Take this weekend and take, the next 10 days and sit with this concept of Is sleep what I need, or is rest what I need? Okay? Are you battling with insomnia, where sleep has become your enemy? Right? Are you lost mistress? You can't fight to go to sleep. Neurologically, it just doesn't work. But can you find rest? Can you find 30 minutes in your day to just sit back, push yourself back from the table, from the desk, and chill the hell out? Just. Now, that doesn't mean you need to post up somewhere and light some incense and, sit in a yoga position and blah, blah. If you can and that's your jam, do it. I know for me, I have the luxury, because as a massage therapist, I have a table in my room that I can lay on. But even if I'm working at home or I'm on the road, I may take 10, 15 minutes of my lunch, eat my lunch, and then just chill. Put some music on. It doesn't have to be relaxing music. It just has to be soothing to me. So last week, one of my downtimes was I listened to the Rage Against the Machine concert live from Woodstock '94.
It's relaxing.
But it was the frequency of the crowd and the stage and the music that came up and met me where I was at and allowed me to turn the volume down. Okay? That allowed me to rest.
It's different for everybody.
It is.
You really have to, you got to get to know yourself. That's where mindfulness comes in, like that exercise we did at the very beginning, just stopping for a minute and journeying inward. What's going on with me? Do an OODA assessment here. What do I need right now? And give it to yourself. In a work day, we don't have a lot of time to sit. We can't take a nap usually, unless we take it during our lunch, which sometimes I do. But anybody can take 30 seconds to sit somewhere and breathe. Just close your eyes, don't close your eyes, whatever, and just breathe and take stock. What's going on? What do I need? Where do I need that breath? What am I feeling? Where am I tight?
And if you're struggling to find those spaces, call your local massage therapist. Okay, if you're in Orlando, give me a shout. Central Florida, give me a shout. For those of you in Ohio, when the time comes, I'll let you know. We're just not there yet. Anything else you would like to add?
I don't think so.
Okay.
Thank you guys so much for hanging out with us.
So we're going to leave you on this. Okay, so let's do a couple breaths. We're going to do 3. Deep breath in. So as we leave you, recognize that breath you just took, there were people out there that couldn't and didn't. So each one you get, find value in it. And be good to each other.
Bye, guys.
See ya.